Good morning, Dr. PK here, part of the video series called Your Question, My Answer. And today I have a question from one of the follower called Timeline. She asked, I have osteopenia and I have been on Prolia for 7 years. Now my doctor wants me to go on oral medication. Do you think that is okay? So this video is about switching from Prolia to oral bone medication and what you need to know. Hello everybody, Dr. PK here. So I'm going to talk about osteopenia, osteoporosis treatment, especially what happens when you switch from Prolia to oral medication. This is an important topic. So if you are loved ones in this situation, taking one of the medication, stick around because I'm going to break this down very easy layperson language for you. So I think that maybe your doctor has suggested that you switch from Prolia to an oral medication. That's what the person is asking. And that person is wondering, is it okay to switch? And what should you expect? So I'm here to explain a key thing that you need to know to keep your bones healthy and strong. So timing matters. First thing is timing matters. If you have been on Prolia for osteoporosis treatment and are about to stop, it's essential to make the transition carefully. Prolia is a powerful injection that helps reduce bone breakdown, but stopping it abruptly without a plan can increase your risk of fracture. That's why most doctors start you on an oral bisphosphonates around the same time you would be due for your next Prolia injection. Oral options like alendronate, which is Fosamax, or risedronate, which is Actonel, are common choices. This helps lock in the benefits you have already gained from Prolia, preventing rebound bone loss. So switching it often is okay as long as it's done with proper planning. So here the key question you should ask your doctor when transitioning. When is your next Prolia dose due? You don't want to miss that window. Do you really need Prolia if you only have osteopenia? Prolia is not used, it's easily reserved for higher fracture risk. So make sure that's the right choice for you. Prolia is not a treatment for osteopenia. Have you had recent DEXA scan or FRAX score? This helps determine your true fracture risk and guides the medication choice. That's important. Do you have any swallowing or digestive issues? Some of the oral medication like Fosamax or Actonel may cause reflux and ulcer problem. So in that case, IV medication like zoledronic acid, Reclast, might be recommended. Now let's talk about the vitamin D, calcium, and lifestyle. In addition to all the medication, don't forget about these basics. Vitamin D, make sure your vitamin D levels are okay. It should be between 30 to 50 nanogram per ml range for ideal bone health. Calcium, aim for 1000 to 1200 milligram a day, but ideally from food sources like dairy, leafy greens, or fortified product. Exercise, strength training, balance exercise are vital to prevent falls and fractures. They will help you build that strength your bone need to stay resilient, right? So now I've also seen some comments suggesting vitamin D3 with K2 are all you need for bone health. Well, they're important. Somebody said that's what you need, vitamin D3 and K2. You don't need anything else. But I want to clarify that while they're important, they don't replace the powerful medication like Prolia and oral bisphosphonates, especially when your fracture risk is higher. Remember, these medication work, they help reduce fractures, which is the goal. Vitamin D and calcium are supportive, but they are not substitute for prescription bone medication if your risk is elevated. So if you're transitioning from Prolia to an oral medication, make sure you do it carefully. Ask your doctor the right question. Stay on top of your vitamin D and calcium levels. Most importantly, don't delay the switch. Get your bones the protection they need. I hope this video helped clarify your options. If you found this information helpful, don't forget to like, share, and subscribe and repost. Thank you for watching.